HealthLeads is a national healthcare organization that connects low-income patients with the basic resources that they need to be healthy. HealthLeads essentially gives healthcare to people who are in poverty and can't afford it. HealthLeads was founded in 1996 at Harvard College by sophomore Rebecca Oni alongside Dr. Barry Zuckerman, who was the chief of pediatrics at Boston Medical Center at the time. HealthLeads is a very interesting business model. Its facilities are operated mainly by physicians and college volunteers who work together to match incoming patients with available resources. HealthLeads puts a lot of stress on their volunteers. Student advocates are a key part of the model, which involves mobilizing undergraduate volunteers in partnership with providers and urban clinics to connect low-income patients with the basic resources that include food, housing, and heating assistance that are needed in order to be healthy and survive. HealthLeads meets on Sundays between 6 o'clock and 7:30 p.m. in Cumberland Hall on the University of Maryland campus. Here at the University of Maryland, HealthLeads attempts to understand and think about what they could do better in order to improve the community that they currently are in. By doing this, HealthLeads is taking a proactive attempt to better enhance a college student's education of the healthcare system.
Daniel Goldberg, and I am a sophomore communications major.
Daniel, have you ever heard of HealthLeads?
I have not heard of an organization called HealthLeads.
So HealthLeads is the national healthcare organization that connects low-income patients with the basic resources that they need to be healthy. Essentially, it gives low-income families the ability to have healthcare. Would you ever become a part of this organization?
I don't know about that specific organization, but I think it's important that every person have access to healthcare, so I think what they're doing is a great service. I might donate to them, but I don't think I could work with them in terms of just hands-on changing them.
Did you know that HealthLeads has recently come to the University of Maryland?
I did not know that.
Interesting.
Unfortunately, at the University of Maryland, people don't realize that there is a HealthLeads program installed and how helpful it could actually be in the overall outcome of their lives.
I'm here with Aisha Ahmed, a student advocate for HealthLeads. So my first question is going to be, how long have you been a member of HealthLeads?
I joined HealthLeads my spring semester of my junior year, so this is my 4th semester doing it.
Why did you originally join?
I'd heard about HealthLeads from a friend. He knew I was a public health major, so he just kind of like recommended it to me. And then I just like did a little more research, and I just really liked like the mission and everything the organization was about. So I decided to apply, and luckily I got in.
HealthLeads has a major strategy in order to advance and grow. In 2014 alone, they're trying to grow significantly beyond its current partner hospitals and clinics. In addition to scaling up its current model, the organization is also working on building a strong business case for why the healthcare system should pay for the service. On average, nearly 60% of patients referred to HealthLeads had at least one critical need met within 90 days of their first appointment.
What do you like the most about HealthLeads?
I think I like that you really feel like you're making a difference in people's lives. It's not like a normal student organization where you're just doing like fundraising or awareness. You're actually like working with people like face to face and getting like hands-on experience.
Okay. What would you like to see change about HealthLeads?
I guess if I had to think of something, a lot of like the trainings or like things that we do at our meetings get really, really repetitive for advocates who have been there for a really long time, like me. So I wish they would like make some meetings only required for like new advocates, which is actually something they've suggested to change for next semester. So hopefully that does happen.
Okay, and how would you say that HealthLeads motivates their members to continue with the work that you guys do?
We are always constantly celebrating like every success that we have, like every meeting. We always do like shout outs and like go through the week and like talk about like what we did well, and we just celebrate our successes, and I think that just keeps people motivated.
Okay. If you could describe Health Leads in 3 words, what would those 3 words be?
That's a hard question.
Okay.
What is your name and occupation?
It's Maria Pelletier. I'm a nurse supervisor at East Boston Neighborhood Health Center.
Would you consider your patients to mainly come from poverty and low-income families?
Yes, the overwhelming majority of our patients are from low income, below the poverty line.
Does the healthcare system provide enough support for these patients in poverty?
No, the healthcare system provides no adjunct supports to our patients. They provide medical care, and that's it. So anything contributing to their medical problems is not taken care of.
Over the years, with the drastic increase in people being uninsured or covered by the government in healthcare services, many people have begun to look at a company like, for instance, Health Leads, in order to insure them and make sure that all of their necessities from a healthcare standpoint are taken care of.
Do you think partnering with an organization that helps provide these basic needs to patients in poverty would be beneficial to both the patients and the healthcare system overall?
Yes, overwhelmingly. Any support systems to our patients that are not directly medically related, but perhaps related to housing, education, learning English, any of the things that basically just contribute to a better sense of health and well-being will ultimately improve their health, their overall health. I mean, there's just no downside to this.